I'm Dr. Dhananjay Parab, associated with Zynova Shalby Hospitals, Ghatkopar. So we have talked about Women's Day, we have talked about osteoarthritis in women. Most commonly, women do have complaints of knee pain. So I am going to talk about knee pain, specifically knee pain. The age could be different. I can divide knee pain in women into three categories. Most commonly seen in OPDs are young females, working females, a housewife, it could be anybody. So these women come with crackling pain in the knee pain. They also come with pain when they are trying to walk stairs or come down stairs, or also there is pain when they try to get up from a sitting position. So in this category is between 20 to 40 years of age group, very common. The problem is cartilage weakness. There is no arthritis. People might ask you to get MRIs done, investigations done, but the most common cause is weakness in the cartilage. That weakness is usually due to deficiencies in our nutrients plus lack of exercise. 20 to 40 is, you can say, it's the most productive time of our life. That is when the maximum workload of a female happens. So during that time, if the nutrition is not proper, if there is no proper exercise, your knees are bound to suffer. So these symptoms usually, they lead to that diagnosis that yes, there is some problem in the knee, there is some cartilage weakness which has to be taken care of. You just need to modify your lifestyle, you need to add certain exercises, you have to take precautions where you don't sit down, don't walk too many stairs, don't push yourself too much. So when you modify all these smaller things, you will definitely get better. Plus, you see an orthopedic surgeon who will advise you certain supplements for your cartilage. This is for 20 to 40. As soon as you cross 45, 50, and women who have pushed too far and who have ignored their knee pain, they have ignored their knees, you then start getting arthritis. They start to have, and check the research, check the articles, you will see women are more prone for osteoarthritis. So in that situation, they lead, these causes more arthritis in women. You can see more knee problems, more deformities. The knee patients usually come with knee deformities. They are unable to walk properly. There is limping at a very early age. We have operated patients who are even 45, 50. So you have to take proper consultation from a doctor. You have to identify the problem as early as possible and then treat accordingly. Treatment could be anything. It could be just medical treatment, it could be physiotherapy, and in case it's very bad, the deformity is very bad, then you need a total knee replacement or a partial knee replacement. But diagnosing the problem and treatment on time is very, very important. That's why if you have knee pain, please consult us. Zero technique, it involves a minimally invasive surgery. It is a minimally invasive surgery where the incision is very smaller. We have got the incision down from 6 inches, 8 inches to almost 4 to 5 inches smaller. The incision is very small. The bleeding which happens, so if the incision is small, the bleeding is lesser. Our surgical technique has reduced the instruments to very bare minimum. So if the instruments are very few, the surgical technique is faster. We are able to finish a knee replacement surgery in 15 to 20 minutes. That's all it takes, because the technique has been modified in such a way. The precision is almost next to a robotic surgery or a computer navigation surgery. Precision, what we have achieved is a very smaller incision, lesser bleeding. That's why the physiotherapy needed is very, very, you can say it is painless. The patient is able to walk within few hours. Some patients are able, they can lift their leg up within 2-3 hours. They are able to move around, they are comfortable. The pain is almost down to zero. Physiotherapy post-op is needed for hardly 10 to 15 days, and female patient can get back to her daily routine in 15 to 20 days. She can help out in her routine kitchen work. She can go out. Office going person, male or female, they can go visit their office for a few hours and come back. So you get back to normalcy in very little time. That's what we want to achieve with knee replacement. We want to improve your lifestyle. We don't want to keep you bedridden as a patient. We want to change your lifestyle so that you can get back to routine activities as early as possible. So please take this opportunity, see us, help us to get you back to normalcy. Thank you.